The South African Medical Association trade union, that's SAMATU, will support or has support then from COSATU and are marching to the National Treasury. SAMATU is marching to raise the plight of unemployed medical doctors, the shortage of staff, as well as the improvement of infrastructure and security at healthcare facilities. Vuyolwethu Yamba is joining us now then and is at the start of that march at the union buildings in Pretoria. Let's talk about how well this march then is supported. Vuyolwethu, if you could help.
Well, Arabile, it's 1,800 doctors that are here in the union buildings. I mean, they have been complaining about this thing of being unemployed, and when the minister responded to their complaints, he said there is not enough money, to hire these doctors. Now they are here trying to see if they can talk to one of, if they can talk to some. Sorry, Arabila, got distracted there for a minute. They are here to hand out as well the memorandum. And now next to me, let me talk to Dr. one of the leaders of SAMATU and get a little bit deeper into this conversation. Doc, thank you so much for making time for us. Let's dive deeper into this thing. When the minister responded to some of the issues you had, I believe a few weeks ago, he said there's not enough money. What's your reaction as the union?
As a union, we think that if our government and the department is taking it serious, health, safety and security should be a priority in the country. There's no way that we'll have in a country that is riddled with diseases, and we have a lot of doctors who are unemployed and shortages in the clinics, yet we get told there's no money. It means that we have leadership that does not plan, and perhaps the West that does not care about its people. It does not make sense at all that we have more than 1,500 doctors unemployed, and yet you go to hospitals today and now, you'll find that there's no doctors, or there's only one doctor on call who's exhausted, who's making mistakes because of exhaustion, with long queues of people waiting for just one doctor when we have a lot of them at home. We think that government can prioritize, can shift some of the monies that are there, and hence we thought that we must stay away from talking to the Department of Health, who is our primary employer, and talk to the source that they always talk about. They say Treasury didn't give them enough money. So that's why today we are here to take the memorandum to the National Treasury. The Treasury must tell us if that is true. If it's true, then they must have a plan. The next budget, the current budget, there's something that they can move. We have government departments that are retaining the funds unused. Why can't those monies be diverted to health so that we can employ these doctors that are on the streets? And by the way, what the minister had said, that people must go and work in private or go overseas, is true, they can go. And there's a lot of people who have gone. But what about the people who want to save their own people, their own country, who are loyal to their country, who are loyal to their own people? And they want to be employed, not because they are chasing the money. Of course, you have to be paid. But they want to deliver the healthcare service, which we don't have as a country. It does not make sense. It means that we are leaderless, or we are led by people who don't care about their own people. If we have doctors in the streets, doctors roaming around, doctors end up doing other courses when they are supposed to be employed.
What do you think should be done?
I think they need to go back to the drawing board and look into the ratio that we have. WHO says the acceptable ratio is like about 1:1,000, it will be acceptable. Right now we are beyond 1:3,000, which means that one doctor is looking after 3,000 patients. So they need to look about what they are doing. One, government had demanded that the training institutions, the university, must increase the number of doctors they produce a year. And they did that. They even sent people to Cuba to train so that they increase the number. That was a good move, and we thought that we have a government that has a vision. So now those people that they were training are out there in the market. They don't want to employ them. What was the plan all about? The plan was about to decrease that ratio, to come closer to 1:1,000 that is recommended by WHO. But now that we have those resources, human resources, why are they not being used? I think there's a need to immediately sit down as a country, all departments, all stakeholders, including the doctors who are working, including the doctors who are in management, so that this crisis must be discussed. Or else we are going to spend years and years doing a catch-up when we have an ill health system.
Thank you so much for your time, Dr. Langeni Mbodi, the president of SAMATU right there, Arabile. Well, some of the issues they are facing is unemployment, and this could result into public sector, the public hospitals lacking some of, the health workers. And we will hear as the day goes as to what is the way forward. But for now, back to you.
Vuyolwethu, Yamba, thank you so much for that reporting out of Pretoria.